The journey back to reality. How psychosis is mitigated in people. Psychosis can feel like a person's connection to reality has frayed, thoughts become tangled, perceptions shift, and the world may feel threatening or unreal. But this experience is medical, treatable, and reversible. Professionals approach psychosis as both a biological condition and a human experience. Below is the story of how care often unfolds, backed by clinical best practices. Chapter 1. Catching the early signals. Psychosis rarely arrives all at once. Friends and family may notice first. A student who once excelled suddenly isolates and stops turning in work. A co-worker becomes convinced others are whispering about them. A loved one speaks of messages hidden in television shows. These are early warning signs. The sooner professionals are involved, the better the recovery. Example: a college counselor recognizes rapid personality change in a 19-year-old and refers them to an early psychosis intervention program, preventing further decline. Chapter 2. Medical stabilization. Once a clinician confirms psychosis, the first goal is safety and symptom control. Doctors often prescribe antipsychotic medication, which works on neurotransmitters like dopamine, a key player in perception and belief formation. Hallucinations soften, delusions lose their grip, anxiety and confusion decrease. Medication is carefully monitored to balance effectiveness and side effects. Example: after starting a low-dose antipsychotic, a person who believed drones were tracking them begins to question that fear and regains restful sleep. Chapter 3. Therapy and coping skills. Medication helps, but therapy teaches understanding. Cognitive behavioral therapy for psychosis, CBTp, helps individuals separate what feels real from what is real, reduces the distress of voices and unusual beliefs. Therapists also provide tools, grounding techniques during hallucinations, methods to challenge paranoid thoughts, communication and problem-solving skills. Example: a therapist helps someone reinterpret a frightening voice as a symptom, not a command, reducing panic and improving control. Chapter 4. Treating the causes beneath psychosis is often a symptom of something larger. Cause treatment focus: schizophrenia or bipolar disorder, long-term psychiatric care, trauma-informed therapy, support, substance-induced psychosis, detox, substance use treatment, brain illness, injury, neurological care. Example: a person experiencing psychosis after heavy stimulant use receives detox treatment, and their hallucinations fade once the substance clears. Addressing the root prevents recurrence. Chapter 5. A circle of support. Recovery doesn't happen alone. Families learn how to respond calmly to delusions, what triggers to avoid, how to support treatment without pressure. Social programs help with education and job return, housing stability, peer support networks. Example: a family creates a relapse plan with signals like reduced sleep or increasing mistrust. When early signs reappear, they contact the clinician immediately. Crisis averted. Support systems restore community and dignity. Chapter 6. Lifestyle strengthens the brain. Healthy routines strengthen stability. Sleep is one of the biggest protective factors, avoiding alcohol and recreational drugs. Structured days and meaningful activities, stress management strategies. Example: a daily schedule that combines morning exercise, medication, therapy, and hobby time helps a young adult maintain steady progress. Small habits protect big recoveries. Chapter 7. Long-term care and monitoring. Psychosis can return, so ongoing care matters. Regular check-ins detect subtle warning signs. Medication might be adjusted over time. Safety plans stay in place. The goal is prevention, not just treatment. Example: a person calls their therapist as soon as they notice a returning belief that neighbors are watching, stopping relapse before it starts. Final truth: psychosis is not a life sentence. It's a treatable medical condition, and with the right support, people return to school, people rebuild relationships, people lead full, meaningful lives. Science, compassion, and early intervention make recovery possible.